Hello everyone, today we're talking about the Ambu Orgain. This is a LMA, an extraglottic airway device. This is the same device we've had in our service for many years. We're leaning towards this one over the iGel, and we'll be phasing out the iGel shortly. Just like in years past, we ordered these from size 1 to size 5. There's size 1, 1.5, 2, 2.5, 3, 4, and 5. Which size you'll use is going to be determined on your patient, whether it's an adult or a pediatric. The ones that are adults say adult on the packaging. They also have an indication of the weight size. However, with these devices, it's sometimes best to go based on the patient's height. Typically, if a patient is below the height of 5 foot, you would use a 3. If they're above 5 and below 6, you would typically use a 4. And anything above a 6 foot patient would most likely be a 5. It's just going to be patient dependent, and you'll go from there. For insertion of the device for this patient, first things first, like all airway devices, you want to make sure that your patient is properly pre-oxygenated. In this one, we're going to pick a size 4. This one's a little different than the iGel. It doesn't come with all of our necessary equipment. We need the package itself. We need some gel, lubricating gel, and you also need a syringe. So for this one, you'll open up the package, revealing your device. You want to make sure that the device is intact and there's no obvious damages. It comes in this little plastic protectant sheath. You want to make sure you remove that. So we're going to deflate the device. You want to do it on a sterile package or sterile surface, on a flat surface. So we're just going to go ahead and use the surface that it actually comes in, the packaging. With one hand, you want to make sure that it stays flat, and the other hand, you want to pull out the air. Once you have it in a nice flat surface, you can remove this, set it to the amount of air you want. The packaging says the size, and also so does the little pilot balloon. It says 30 is the max. You don't have to use the full 30, you can use less than that. It's actually preferred to use less. So I'm gonna have it set for 20, set that aside, put my device down for what's ready to use. And I'm actually still a technique that we have from the iGel, and I'm going to use this little surface here as a lubricating surface. So I'm going to drop my lubricant on the inside of this. You're going to lubricate the distal tip, and you're also going to lubricate the posterior aspect of the cuff. Once all that is properly lubricated, you're going to have your patient, who's, like I said, is pre-oxygenated, is now in a sniffing position. You want to make sure that the airway is open. For some patients, their tongue might be in the way, so you might need to get in there and actually move the tongue. This one, you're going to insert, holding it kind of like a flute or a pencil. And you're going to put the tip against the hard palate and follow that hard palate all the way through until you feel a definitive resistance. Once definitive resistance is felt, you're going to stop, you're going to let go of the device, and you're going to insert your air. Once you feel that there's really not much air you can give, you can let go of it, and you'll see that it might have raised. There's going to be 2 black lines on this backside of the device. As long as the teeth, the patient's incisors, are between those 2 black lines, you know your proper placement. In order to ensure your placement, you want to get your end tidal. You're going to place your end tidal on the device, and then you're going to place your BVM. You're going to connect your end tidal, because that is our definitive way of ensuring an airway is secure. And you'll bag the patient looking for end tidal waveform. Once we know we have that secure, airways device is secure, you could strap this down using tape to tape it to the patient's face, or actually our tube tamers will work for this patient. We have our airway secured with our Orgain. Now we want to make sure that if we need any suction, we can use the appropriate devices. For this device, the number 4, you use a 16 French. You'll actually use a 16 French for a number 4, number 3, and a number 5. So you get your French device. You can remove it from the packaging. Using the lube that's already on here, or you might need to apply more. You can apply more lube. You want to try to lube up the actual distal tip of this, and you might even need to lube the gastric tube tip of the device. Once it's all properly lubricated, you'll go ahead and insert the device through the gastric suction tube. and you can perform a suction using the device just like you normally would. That's the AMBU Orgain. If you have any questions, comments, concerns, please contact an on-duty 7-8. We can happily help you or your training facility. Thank you.